Hello, everyone. Good morning, good afternoon, and good evening. I'm Evelyn Santiago, the Executive Director of ARNEC, and I warmly welcome you to ARNEC's webinar series on young children amidst COVID-19. Thank you for joining today's webinar, which aims to first understand the impact of COVID-19 on the situation of early childhood educators and childcare professionals in the Asia-Pacific region, and second, to discuss interventions to support them during and beyond the pandemic. This webinar is jointly organized by ARNEC and UNESCO Bangkok. This webinar series, which aims to facilitate learning in the ECD community, is one of ARNEC's response strategies to the pandemic in the region. Through these webinars, we aim to mobilize and connect the ECD community with partners in the region who are implementing practical strategies and innovations for young children and their families. This webinar series is supported by two of our partners, the Open Society Foundations and generally the Human Safety Net. We have already completed 6 webinars in this series, focusing on topics related to how young children and their families are affected by COVID-19, the importance of supporting parents and caregivers as they are now burdened with many responsibilities, as well as understanding how young children cope with anxiety, fear, and stress. We also had a webinar on distance learning approaches for young children and the critical role of play in engaging young children in a meaningful way. We also highlighted in one of our webinars the different protection risks and threats experienced by young children and their families during this pandemic. We've been receiving a good response to these webinars, with participants ranging from 200 plus to 400 plus for each session. Majority of our participants come from Southeast and South Asia, but we also have good following from the rest of the world. In case you have missed these previous webinars, recordings and presentation slides can be accessed from the ARNEC website. Today's webinar will be moderated by Ms. Jessica Hampton. Jessica is the Education Advisor of Child Fund Australia. She oversees a broad range of education programs in the Asia-Pacific region, including Vietnam, Laos, Papua New Guinea, and Timor-Leste. She is also a member of the ARNEC Steering Committee. Thanks, Jessica, for agreeing to moderate today's webinar, and I now give the floor to you.
Thank you very much, Evelyn, and may I extend my welcome to everyone who is listening in from around the different parts of the world today for the 7th webinar in the series on the ECD Workforce Matters 2, Profiles, Impacts and Support Measures taken during and beyond the pandemic. Today we are joined by a range of experts and practitioners on the impacts and about the disruption facing the early childhood workforce during this adverse time and what changes it will make for the future of the sector. Before we begin, just some gentle reminders for the webinar protocols. Please note that the webinar will be recorded and resources will be made available at ARNEC's websites afterwards. If you'd like to raise a question, please use the question and answer Q&A feature located in the Zoom meeting tool at the bottom of the screen, and you can upvote a question by clicking on the thumbs up. Please join us as one of ARNEC's members, and to be informed of the next webinar, you can see the link attached. And if you'd like to like us and follow us on Facebook to get regular updates, that would be great. And finally, we'd like to request your feedback at the end of the webinar. So if you could please complete the survey, which will be sent to you by the link, ARNEC can improve the future sessions to cater better to your needs. Next slide. We'd now like you to participate in a live poll. There will be some questions that pop up on the screen. If you can please select one of the options for each of the questions, and we'll take a few minutes to do that now. Thank you very much for your participation in participating in the live poll. If we're ready to go, I'll now introduce some of the questions that we will be addressing. during this presentation. For our 7th webinar on the ECD Workforce Matters 2, some of the questions that our presenters will be addressing is what is the role of the ECD ECE workforce in fostering access to quality of early childhood education and childcare services? What is the impact of COVID-19 on early childhood educators, preschool teachers, childcare professionals and daycare workers in government supported and privately run preschools and childcare centres in the region? What interventions are necessary for the ECE workforce as preschools and ECD centres prepare to reopen and transition to blended learning approaches, including the use of online platforms, among others? And what can we learn from institutions supporting the ECD workforce to address the impacts of COVID-19 on early childhood educators? Today we have 4 presenters, including Maki Hayashikiwa, Chief of Section for Inclusive Quality Education for UNESCO Bangkok, who will be speaking to us today on ECCE Workforce Matters. Our next presenter will be Dr. Chiam Hang Keng, President of Early Childhood Care and Education Council in Malaysia, who will present to us on the impact of COVID-19 on ECE workforce and the interventions of the workforce. Samantha Page, CEO of Early Childhood Australia, who will be speaking to us on the supporting educators, teachers and service leaders through the pandemic, information sharing and online professional development. And our final speaker for today will be Lee Ji Tan, Assistant Chief Executive of the PAP Community Foundation in Singapore, who will present to us today on COVID-19, Adapting to Change. With that, I'd like to hand over to our first presentation. Thank you very much, Maki.
Thank you very much, Jessica. Good afternoon, good morning, and even good evening. A very warm greetings to everyone, wherever you may be connecting into this webinar today. My name is Maki Hayashikawa, and as introduced, Chief of Section for Inclusive Quality Education here in UNESCO Regional Bureau for Education in the Asia Pacific. I'm very glad to be co-organizing and taking part in the 7th edition of the ARNEC webinar series on young children amidst COVID-19. The theme of today's webinar is on early childhood education workforce, the people without whom we will have no ECE provision to begin with. While much of the world's attention has been on the health concern as a matter of priority given the nature of the crisis, even within the ECC sector, the top concern has always been on the young children's health and well-being. This is very understandable, and no one can argue against prioritizing young children. However, as I just said earlier, quality care and education for children cannot be delivered unless we have a well-supported, dedicated workforce, and their challenge during this pandemic is no less important than other workforce in education or in health sectors, as a matter of fact. Therefore, the title of my presentation to kick off this webinar is exactly ECE Workforce Matters. Next, please. The presentation has 3 parts. First, just to remind ourselves why ECE teachers are so important in ensuring quality ECE provisions. Second, an overview of the impact of COVID-19, specifically on the ECE workforce. And third, the findings from our online survey that was undertaken between April and May 2020. Next slide, please. I believe the majority of the audience to this webinar are ECE advocates. So there may not be a need to go into details, the key variables that affect the quality of ECE today. And as researchers, practitioners, and policy workers, we all know that quality is something that is not absolute but relative, and that it cannot be determined by looking at just one factor, but rather it's a combination of the 4 key variables that characterize the provisions of ECCE, namely the process variables that directly affecting the child outcomes, teacher variables who relate and cares for the young children, structure variables, the environment in which the ECC provision is set up and affects its operation efficiency and effectiveness, and program variables, the content that will be delivered through the environment and by the teachers. Next, please. So the quality ECC provision is often measured by the overall status of child outcome as well, And here, just to represent 8 factors are often identified as key enablers for good child outcomes. And this is the framework provided by European Commission's Quality Framework for Early Childhood Care Education. One of the 8 key enablers is the workforce, the personnel that are well qualified, trained, motivated, and supported with good leadership. Next, please. So while the overall quality of ECC provision services must be defined and measured by having these multiple key variables, I wish to zoom into the workforce teachers, as it's probably fair to say that the most important element in pursuing quality ECC, among others, is the practitioners or teachers or the workforce in early childhood. And this is what we would say for any teacher at any level of education, but particularly so for the younger children, both ECCE or pre-primary or primary education, given the direct impact that teachers can have on them. For instance, we know from abundance of research that teacher beliefs and perspectives about children's development and quality learning environments can influence organization and practices in an early childhood setting and affect quality and child outcomes. Teachers with more training and experience are more likely to hold child-centered beliefs and engage in similar pedagogical practices, which can be associated with better learning outcomes for children. And pre-primary teachers who are also well trained and equipped with the right knowledge, skills, and conditions are more likely to support age and developmentally appropriate practices, including the rich reciprocal interactions and content teaching that positively influence children's social-emotional development, language development, and cognitive skills. Next, please. Now, as we are all convinced of the importance of teachers or the workforce ECC, let me now briefly put into this into the current context, the COVID-19, and the impact it has had on education overall, and more specifically on the ECE subsector. Since March this year, when UNESCO started to track the impact of COVID-19 on the education sector, 1.57 billion learners, representing over 90% of the world's total enrolled student population, have been affected by school closure. As you can see in this school closure map, updated regularly by UNESCO's Institute for Statistics for a region, Asia Pacific, as of June 1st June, still the majority of the countries here in our region are either closed entirely or locally. Of course, some of the countries have started to also reopen school in the past few weeks. School closures also meant not only having students out of school, but also teachers, principals, and other education personnel being out of school and sometimes out of job. We know that at least 64 million primary and secondary teachers have been affected by the pandemic, over 4.4 million pre-primary teachers in 24 countries in our Asia Pacific region as well. Our teachers, education personnel are the frontline workers for education sector. However, unfortunately, COVID-19 response have often overlooked these millions of teachers, principals, or education personnel in general in the urgent COVID-19 responses. Although media keeps on talking about the risk of significant learning losses among children due to school closure. Next, please. The COVID-19 has really had direct and indirect impact on our education personnel, including early childhood workforce overall. In what ways have they been impacted? These are some of the challenges that education personnel are now facing, and suddenly often without any advance warning or time to prepare for. Due to school closures, distance or remote teaching learning has been introduced in most cases, and the attention has been much on the learners, how to support and motivate the learners to continue their learning via remote distance mode. However, teachers also need attention and support, as teaching in the classroom and teaching remotely are totally different experience, skills, and expectations. COVID-19 has also led many into unemployment due to the shutdown or slowdown of the economy, and the education workforce is no exception to this. In particular, teachers and personnel in private profit education institutions, including many early childhood centers in our region, are more vulnerable than the teachers in the public school sector. A special case for early childhood personnel is that they have also been asked to continue and provide face-to-face care and education for the children of essential frontline workers, often in the health sectors, which means that ECE personnel are putting their own health at risk during this COVID-19 period. Of course, teachers and other education personnel have their own families and even with children who could be staying at home due to school closure. and they would need to look after their own children, making it difficult for them to concentrate on preparing and teaching remotely from home. And it is not only about the current teachers, but our future teaching workforce is also being affected, as school closure is not only in primary and secondary school, but also in teacher training centers and institutions. So it is anticipated that we could face a serious shortage of qualified teachers in the future if the situation continues. Next slide, please. So against this backdrop, UNESCO Bangkok, together with our partners, UNICEF, ARNEC, the Early Child Workforce Initiatives, or ECWI, and International Step-by-Step Association, or ESA, launched an online survey in April that lasted for a month. This online survey, using SurveyMonkey as a platform, targeted early childhood care education center managers, heads of pre-primary preschools, and ECC teachers and education personnel. And may I take this moment to express our sincere thanks to our partners, UNICEF, ARNEC, ECWI, and ESA, for their close cooperation and collaboration in realizing this survey. We were also very fortunate to have many linguistic talents involved in this survey initiative, and managed to make the survey available in 10 regional languages in order to facilitate and attract many respondents in the regional countries who would have not been able to participate if it were only in English. So I wish to also express our appreciation to Simeo Chechep, OMEP Japan, UNESCO field offices in Myanmar and Vietnam, and also Ms. Maria Pangam from the Philippines for her individual support for their kind help in translating the survey into their respective national languages. Next slide, please. This online survey was conducted on a voluntary basis, and the findings are only compiled and analyzed on the basis of questions and issues in the surveys. It does not allow any country comparison or assessment, and is not meant to be findings that could be generalized across all countries in the Asia-Pacific region. It does not attempt to present any representative sample analysis of the targets either. However, with 2,040 individual responses received from the respondents in 34 countries, and this is actually out of the 46 countries under UNESCO's usual regional geographical catchment in Asia Pacific, we believe the survey findings do present to us some important, valuable messages that could be further studied as relevant. It gives us an opportunity or reason to deep dive later. Next slide, please. The survey focused on the education workforce engaged in all types of early childhood care education provisions and services, which for statistical purposes were categorized based on ISCED ECED categories. These are ECD ISCED number 01, covers children age range of 0 to 2 years, and pre-primary education ISCED 02, that covers children from age 3 years to the start of primary education. Here we present the summary of the sample profile by age group and position, level of early childhood care education, employment status, work experiences, and training prior to COVID-19. With age group and position, the majority of respondents concentrated in 20, 30, and 30 and 40 years old, with majority being teachers. The level of early childhood, 2/3 respondents were working at pre-primary education level. And the survey seemed to have attracted individuals who are relatively long in their service already, with many having permanent employment status. So I think the survey managed to attract a relatively more privileged early childhood workers this time. And the training prior to COVID-19. Here, I think it's very important and interesting to see that training includes pre-service and in-service and online personal training. But most interestingly here, and also most worrisome, that clearly majority of teachers respondents have not received any training on distance teaching or learning to be able to effectively get through this critical period to support their young children. More importantly, we've found that respondents lack training on crisis disaster management in general. Next slide, please. Here are some key findings to share regarding the changed situation of the ECE workforce since COVID-19. First, we wanted to know how the situation has changed for them since the outbreak in March. Around 70% of the respondents informed closures of ECE centers and preschools, and due to school closures, 6.7% of respondents said they were approached by their employers to consider leaving or suggested to terminate their contracts. This was a relatively low percentage that we had actually expected to see. Half of the respondents suggested that they had no income security or covered by job security schemes. Because of such insecure financial status, most of them seem to be relying on household head's income For example, we found examples for Indonesia where teachers were trying to find other fixed-term services. Some were also engaged in farming or online marketing and so on. The chart on the right also shows that many ECE educators and centers do not have access to separate COVID-19 response or compensation systems. Yet I wish to also point out here that given the majority of the survey respondents are permanent or fixed contract holders, perhaps the percentage of secure income and job is likely to be higher than the real picture this survey is presenting. Next slide, please. Okay. On the question of strategies that deemed noteworthy of sharing, the survey found that most ECE systems were deploying a mixed media platform for distance teaching and learning. Not surprisingly, ECE institutions in urban areas tend to use online platforms, while rural areas are more likely to use conventional mode of distance teaching and learning, including TVs and radios. Some good examples shared through the survey on strategies for addressing distance teaching and communication with parents included conducting meetings, distributing worksheets, delivering tutorial videos, privately videos through privately financed or privately provided ECDs, reporting activities through reporting activities in general. Next slide, please. On the question regarding specific challenges due to school closure, we found that the basic concern of ensuring equitable access to distance learning was in itself noted the most. The survey did reveal that ECE teachers were not prepared for continuing their teaching by delivering classes through remote or distance modality. It is also interesting to note that while most respondents do have responded to have difficulties with delivering remote distance teaching, the first and foremost concern for early childhood teachers in urban areas was about the quality of learning, while for rural teachers, it was the lack of basic access to ICT infrastructure and equipment to allow distance learning to happen. Next slide, please. The survey also allowed us to understand that there have been some government policy measures introduced to respond to the impact of COVID-19 on the ECC sector, mainly to support the ECE staff, parents, and caregivers so that they can ensure the continuity of children's learning. However, we also revealed that only less than half of the ECE teachers received in-service training and psychosocial support. An important finding is that among all types of support, privately financed ECE institutions are less likely to receive any support compared to publicly financed institutions. Next slide, please. Now, we also asked the type and nature of support and guidance that ECE teachers received in order to effectively continue teaching and working from home. Less than half of the respondents answered that they were receiving one or either or several of these guidance on how to manage the work environment at home, but it's been mostly on health and safety issues and less on the work modality itself. Maintaining a good work-life balance when working from home while using unfamiliar online teaching modalities are not something that one can easily implement without proper guidance. The survey also did not really ask how relevant and practical these guidance were and what were the other missing guidance that they actually really needed. So this is something that we might need to look into further later on. Next slide, please. So this is taking me close to the end of the presentation. Now, this online survey was based on voluntary participation and is not necessarily presents a representative sample from the region or countries or any one single country. We do not intend to draw any specific recommendations using the survey findings that could have immediate policy or intervention implications. However, there are clearly some interesting and important takeaways that could be drawn from the survey findings for further investigation and basis for introducing policy measures later on. First, regarding job security. It's nothing unique or special to the ECE workforce, yet given the vulnerable status that ECE workforce usually has anywhere, it seems critical to ensure measures to provide job security and adequate and timely compensation so that teacher motivation can be maintained and retain the teachers during times of crisis. Second, Distance remote learning, whether online or offline, is not only for school education, but must become a reality for pre-primary early childhood care education. And for this purpose, it is essential that inclusion, equity, and fairness in the provision of distance learning must be ensured from early childhood all the way up. In particular, unequitable access to ICT infrastructure in remote rural areas was the most concern for ECE institutions. Third, while it is not just in time of crisis, but particularly more so, becomes important to ensure relevant quality professional development and support during crisis. Fourth, while in crisis, we need to be ready to take on the new normal with confidence. And for that, it will be imperative to increase investment in teacher training on adapting to new technologies, social-emotional skills, so teachers are more resilient and ready to respond effectively if and when another crisis comes, but hopefully not. Fifth, we should not forget that teachers are also individuals with families, with their own children too. Support to teachers' own health and social-emotional, psychosocial well-being and resilience should be a priority. And lastly, but not the least, given the multi-sectoral nature of early childhood sector, ECE provision should also be supported through an intersectoral approach during and after the crisis so that we can safeguard the holistic development outcomes of the whole child at any given time. And lastly, just before closing, I wish to share with you that a similar survey has just been launched in the sub-Saharan Africa, covering 48 countries, by UNESCO together with the ADIA Intercountry Quality Node for Early Childhood Development, African Early Childhood Network, UNICEF, UNESCO, ICPAP, ILO, and the program Talent, and the World Organization for Preschool Education, or OMEP, or, as better known. The survey is available in English, French, and Portuguese. So we are very happy to say that our survey was used as their base model with adaptation to their African context. And we look forward to hearing more from African colleagues on their findings and to join our forces to spread the word across the world that ECE workforce matters. And matters most at a challenging time like this to make sure no child, no one is left behind today or tomorrow and beyond. Thank you very much.
Thank you very much, Mackie. That was a great presentation and has provided us with an overview of the importance of the ECCE workforce in the region and the situation that the sector is facing as a result of the pandemic, drawing on some of those key findings from the regional survey. It's definitely a concerning time for those working in the sector, and you have provided some really useful suggestions for consideration. Mackie, if you wouldn't mind, before we go on, I might just ask a few questions from that have been sent in from participants previous to the webinar. One of the questions that was sent in was, how can we overcome the impact and support the workforce to motivate them at this time?
Okay. How can we support to overcome? I think certainly it's something that our survey was trying to understand, to see what kind of situation our early childhood workforce were facing right now and what kind of support they may actually need right away, immediately, and also in a slightly more longer term to when the school reopens and when the children come back. Clearly, that's most teachers right now, the support that they would probably appreciate having, and based on our survey, of course, is ongoing professional support, but also psychosocial support as well. There are many attempts being made. We have seen also some countries have already provided special attention to early childhood care workers by providing online courses, ensuring that communication continues through different simple modalities, not necessarily in places where you have good access to ICT technology equipment, but even using mobile phones and mobile applications, and making sure there will be more support among teachers, and also with the support provided to families through that media. We need to also make sure that teachers not only lose jobs because of the situation, but also demotivated because they have challenges addressing, reaching out to children remotely, because I think it is not a very typical environment for young children to be connected remotely from their teachers. It's not like secondary education or even primary education, where our learning environment is not necessarily teaching subjects as such. Early childhood is more than there. There's care and psychosocial support to children. Also, the human interaction is very important at this young age. However, there are also many ways to continue that, making sure that communication technologies are at hand. But also, we see that the continuous guidance and support is critical. And this is what the survey seemed to be implying, that we should not forget that we have early childhood workers are actually our frontline workers and not just the bystanding teachers in the education sector.
Definitely. Thank you, Maki. And just following on that from another question, you spoke a lot about, how do we, how the teachers can be supported. But how can development agencies support the ECD workforce to continue education during this time?
Mm-hmm. I think the development workers have a key role to play here, because often the government will be busy attending to other crisis management, especially because given this is a health sector issue, that of course the bulk of the attention will be going to the health sectors and how to make sure that the medical sector is receiving the priority. And I think this is where, when resources not, the national domestic resources are not enough to secure for the entire education sector, the development partners should try to fill in that gap as much as possible. Another way for the development partners to come in and support this is actually to bring to the attention of the government that early childhood care education, especially the educator in the field, is no exception from the other education sector. And by neglecting the early childhood sector has a longer term impact, a negative impact on children who will eventually, once the school reopens, they will be much more, they will be lagging behind, and the learning losses at the early child level will impact on their next stage of education as well. So I think there will be a need for a lot of policy advocacy by the development partners, but also direct interventions where gaps are seen, where government resources are not reaching.
Definitely, and I think it's a very important point that you make, that we're hoping that ECE is not left behind during this time when there's so much focus on other sectors. And just a final question before we move on. You mentioned the reopening, which is, I think, will present its own challenges. Yeah. Is there a safety framework for reopening of early childhood centres that UNESCO would recommend?
Good point. I'm sorry, for early childhood, we have, there is a school reopening guidance that UNESCO, UNICEF, World Bank, and a World Food Program have issued together jointly recently. And also there's another one coming up on how to manage schools that are reopened already, issued this week from UNESCO. Unfortunately, I haven't seen one that is specifically dedicated to early childhood institutions yet, although the school reopening guidelines do mention already from kindergarten, preschool as much as possible. However, I think the attention will be I think it would be important to give a particular attention to preschool, pre-primary education as well in doing so, because when we talk about school reopening, usually our government counterparts will typically think of primary schools and onwards, upwards, and they tend to forget that there is also pre-primary education, which some countries, they do actually come under the Ministry of Education's authorities, and we should actually keep on reminding that school reopening starts from pre-primary, if not early childhood care, but we hope that that would also happen as well.
Yeah, definitely. So lots of advocacy should be done, and yeah, when there are resources available, we'll make sure those are available on the ARNEC website. Thank you very much, Maki. And we'll now hand over to our next presenter, Dr. Chiam, for our next presentation. Thank you.
Hello. Good morning, good afternoon, and good evening to all the ladies and gentlemen. I'm going to share on the impact of COVID-19 on the ECCE workforce in the private sector. Because of constraint of time, so I'm only concentrating on the private sector. Next, please. Now, in the lockdown in Malaysia, like almost all other countries affected by the COVID-19, locks down the entire country. And this includes all educational institutions. And this means that childcare centers, preschools, also have to close. And that was from the onset of the lockdown, which began on the 18th of March. Now, I'm going to use the word TASCA and TADICA to refer to childcare centers and preschool throughout this presentation, because it's much easier to say TASCA than childcare centers. It's a bit longer. Now, the TASCA are allowed to open since the 4th of May, but the opening of TADICA, there's a preschool, is still uncertain. Now, but although the TASCA were allowed to open since 4th of May, not all of them have reopened. Basically, they find that the number of children returning to the TASCA is too few for them to be profitable. Many of the parents who they are still a bit wary about sending the children back to TASCA. And also some of the parents who are working at home decided not to send the children back to TASCA. But of course, those parents who return to work will be sending the children, are sending the children to TASCA because they need that kind of service. Next, please. Now, the impact of the lockdown on the ECC workforce in the private sector. Now, the other industry, the early child care education industry is affected by the extended closure or a home restriction. We actually have been closed down for almost 2 months, 2.5 months, and to be exact, it's 81 days that we are being locked in. And I'm going to discuss the impact from two perspectives, professionally and financially. Next, please. Now, from the professional perspective, children's development and well-being have to be continued. We cannot allow the closure to affect their development, and so the preschool or the TADICA carried out online activities or classes so that the children will continue with their learning and development. However, the teachers need reskilling almost overnight, because they've never had any experience in preparing online materials. They've never experienced in teaching virtual classes, and also quite a number of the preschool teachers are not technologically savvy. And so it's a new skill that to learn how to use this platform. But also the teachers are also stressed out, because the lockdown not only had to conduct classes and so forth, they are also affected physically and psychologically, because they have to adapt. Physically, they cannot they don't have freedom of movement. Psychologically too, the fear of contacting or being infected by the COVID-19, and also about the employment. So they do have psychological problems. Next, please. Now, some of the initiatives have been carried out for reskilling of the early child educators in the private sector. Really, most of this reskilling have been carried out by the individual TASCA or TADICA themselves. The reskilling in most of the TASCA and TADICA is through collaborative learning. In other words, those who are technologically savvy will teach their peers, and together they sort of help one another to plan the online activities. And in fact, during this time, it has also been sort of exposed some of those early child educators who are very creative. And so they provide, later on I share with some of the findings, they provide really quality early childhood online classes. And the ECC Council also help its members by providing suggestions for activities. That we send regular information and suggestions for activities, resources that are available, articles that help them how to be more creative, what kind of activities that they carried out. And we also conduct workshops, webinars. For example, quite early on, we conducted one of the webinar was on how to conduct online classroom. And the council also posts some of these suggestions and resources on the Facebook to help those who are not members of the council. The training institution are also coming in to provide the reskilling of the early child educators. They also conduct webinars, and either just several webinars or a series of webinars on online teaching, and some have incorporated online teaching into the current courses. So these are some of the initiatives. Next, now the council carried out 2 surveys, one to get information from the parents and the other from the operators themselves. Now I want to share to show that the parents, from the parents' perspective first, the first one table shows that when we asked whether the TASCA and TADICA provide online activity, and 89.2% said yes. And they also 89% provide assignments, homework, so that the children can be able to do work. And they also provide offline activities where the parents can carry out with the children, and this could be more of the fun activities. And we asked whether they have access to online activities, and those who have access, well, how do they rate? And we give 5 to good, 5 to very good, 4 to good, average 3, and poor would be 1. And it shows that the very good we have 69%, 16.9%, and the good is 40.2%. So if you add these 2 categories, more than 50% of the activities are very good, and 35.1% said they're average. And we also asked whether the children enjoy the activities, because we want to show also to reflect the quality of the online activities. And 18.9% say that the children enjoys and look forward to the online classes. And 36.8% said they enjoy most of the activities. Again, if you add these 2 categories, again, over 50% of the shows that the activities are of high quality. And 34.5% say they like them and they enjoy them, but not necessarily all of them. Then we are I want to show that from the operator's perspective, when we ask whether they do carry out online activities, 81.3% said yes. Now, if you were to take away the TASCA or the childcare centers, in fact, the number of TADICA that will carry out this online activity will be much higher, because fewer of the TASCA carry out online activities. But nevertheless, there is this digital divide, because there are some areas when we find that those that are not effective are those the parents do not have enough of gadgets. The parent may have 1 or 2 smartphones and to share, or the internet connection is not that good. Next, please. Impact. So let us look from the impact from the financial perspective. Again, our research shows that we asked the TASCA and TADICA depend on the fees for the income. So we asked whether the parents should ask the parents whether they should pay the fees, and only 69%, 69.8% said yes, and they'll put the number 30-odd% said no, and this means the income would definitely be affected. And we also asked that when they reopen, the cost of operation be higher because of the number of teachers, because of the social distancing, then the ratio of teacher to the child ratio would be much lower. That means they have either to take in fewer children or they have more teachers. And there's also the cost of disinfecting and all this infection, disinfecting materials and so forth. So the cost will go higher. And we asked the parents if they're willing to pay more, but they said no. And so we asked from the operator's perspective, and would they have problem in collecting the fees? And majority of them say yes. 85.7% say yes. And also, the majority also gave discount, 87.0%. In fact, parents are unhappy if they do not give the discount, saying there's no, they don't operate, they only go online, so that it costs less and so forth. So they expected to have a lower, to have a discount. And also 49.8% of them have said that parents have withdrawn their children. So there are less children now attending, although they provide online activities. Next, please. And therefore, next, please. And therefore, if you look at the implication on the ECCE workforce, because of the drop of income due to parents not paying the fee of the discount, this means that the expenditure remains almost the same. The income is less, the expenditure remains the same because they have still to pay the employment law requires all the staff to pay the full salary, and they're also to maintain, like including rental. And this means the income is dropped, but expenditure remain almost the same. There will be a deficit. And if it continues for months and months, there'll be great losses, which some of them have already indicated that they will not be able to tolerate any more extension. And this means that we're forced to close down. When they're forced to close down, this means that we're unemployment. And also, in fact, some of the currently they are facing difficulties. They have negotiated with their employees whether they are prepared to take a cut in the salary, although by law they are not allowed to do so. So next, please. So let us look at some of the some aspects of the financial assistance from the government. In reality, there is no financial assistance specific to TASCA or TADICA until lately, that is June, with the announcement of the National Economy Recovery Plan. But this recovery plan only benefits TASCA, these childcare centers. Parents who send their children to TASCA can claim tax incentives up to $3,000 per month, $1,000 in totality from the tax incentive, and the TASCA get one-off grant of $5,000. And if you convert the exchange rate is 4.3 to 1 USD, so that's the amount that they'll be getting. Now, although we have stimulus package to help during this shutdown period, and TASCA and TADICA are considered a small to medium industry. And as a small SME, the employers can get a subsidy of 1,200 ringgit per month for 3 months. But there is this condition that if and they must be these employees, the employees must have contributed to a social security organization. And the second condition is that the employer has to pay to employ the staff for at least another 6 months. So in other words, they have employment for 6 months. So some of the employer did not sort of accept this subsidy because they are not sure that they're able to retain the workers for another 3 months, because they're fearful that they may have to close down. So I think I have my time's up. So thank you very much. Thank you.
Thank you very much, Dr. Chen. That was very interesting to hear on the impact of COVID-19 on the ECE workforce in Malaysia and the interventions that have been introduced, particularly on the reskilling. That was a really interesting intervention. And I think there are many things that others can learn from the region from those examples. I'd now like to ask on our next speaker, Samantha Page, to present for us. Over to you, Samantha.
Thank you. Thanks, Jessica, and thanks, everybody. And it's been fascinating to hear the different approaches across different countries. I'm just going to share my screen. Thank you. So I'm just going to give a bit of an overview, and I apologise in advance that it's been a bit busy here over the weekend. We had a major policy announcement over the weekend, so I've been a bit crazy with media interviews and responding to that. And so I didn't have quite as much time as I would like to prepare for this webinar, but I have put some slides together that I'll talk to. Here in Australia, through December and January, the coronavirus was really not considered a threat. We were busy at the time dealing with bushfires. We had bushfires in 4 different states and considerable loss of property and indeed a number of firefighters and people. So it really wasn't until February that the coronavirus really started to become a serious issue here, and then it happened very quickly. So the national health approach was to flatten the curve, and I'm sure many of you have seen this graph in many other presentations, but the idea was that we needed to try and stop the spread of the virus as quickly as we could by implementing public health measures, and those included increasing hygiene, getting everybody to wash their hands, sneezing into their elbows, stopping international travel, and all the borders were closed. That was unprecedented here in Australia. And then encouraging people to stay at home. So anyone who could work from home was asked to work from home. There were quite stringent isolation measures put into place. And in several states, students were asked to stay at home and participate in online learning or home-based schooling and not attend schools. Now, at that point in time, as we entered March, in early childhood services, attendance suddenly dropped. It dropped by at least 30% across the board, but in some services it dropped by as much as 90%. Where schools were closed, parents had the very clear message to keep children at home, and so that's what they did, and quite sensibly so. But there were problems with that because the way the childcare subsidy works in Australia, services are legally required to charge the fee, the full fee to the parent, and then the subsidy covers some of that, but the parent still has a gap fee. And they're not legally allowed to waive that gap fee, which meant that parents were keeping children at home because of COVID-19, but still being charged for the childcare they weren't using. And that was problematic for parents, and so they began cancelling their enrolments. And in a 2-week period, we saw more than 30% of enrolments withdrawn, and some services were reporting up to 70% of enrolments cancelled. So we started to see services shutting down at that point, and to be honest with you, we were preparing as a national organisation, we were preparing for a national shutdown. We thought it was only a matter of time before early childhood education and care was instructed to close in the same way that schools had been instructed to close, and that's we were thinking that we would need to shift very quickly to supporting families through online technology. However, the government then announced a relief package in mid-March to keep services open and operating and made some very clear policy statements at that time that they wanted early childhood services to continue to operate through the pandemic, and that priority was to be given to families in essential worker roles, which was always a bit difficult to define, but included certainly people in health services and the frontline roles such as that, as well as children who were vulnerable or disadvantaged, and who needed to keep attending early childhood education services. And at that point, the relief package meant that services had to stay open, and they would receive approximately 50% of the childcare subsidy revenue they were receiving in a reference fortnight before the pandemic started. And then it was a matter for them to decide how many children they could cater for on site, how many staff they needed to continue to employ. And at the same time, there was another payment introduced to secure jobs, and that was called the JobKeeper payment, and a lot of and early childhood services were encouraged to apply for that and have as many of their staff as possible on the JobKeeper payment. For Early Childhood Australia, as a peak national body, we had an immediate job in trying to keep members informed of what was happening, because everything was happening very quickly, and there were competing and conflicting advisories coming from different layers of government. So I'm sure, like other countries, we have a national government, we have state government, and then we have local government, and services were getting very different messages from different layers of government about what they should do and whether they should continue operating or whether they needed to change their practice models. And our first job was really to set up a website and to do a series of live webinars for members and other service providers to try and keep them ahead of what was happening. There were several areas of complexity, and it sounds, listening to other countries' experiences, that these are quite common. The first was in changing funding arrangements. So suddenly childcare was free, services couldn't charge families fees, workforce subsidies were in place to keep staff engaged, and government funding was flowing. But there were a lot of conditions with that government funding, and it did change the relationship between services that had previously considered themselves to be autonomous businesses and organisations, and families who were used to having a fee-based relationship for their early education, and the government. The next major area of concern was how to operate safely, how to increase the hygiene practices. A lot of information being shared between services about hygiene practices, hand washing videos and songs to sing, and ways to encourage children to engage in more frequent hand washing, much more regular cleaning of surfaces and learning environments, changes to practice in terms of the space requirements per child, the practice of spreading children out across the centre, but at the same time trying to minimise the risk of cross-infection by keeping children in the same group and educators consistently working with the same group. And other practices in terms of not sharing materials such as Play-Doh or clay, and trying to minimise any risk that children might be exposed to the virus or that staff might be exposed. And a lot of questions and concerns coming from staff, as Maki mentioned, staff themselves have their own families they're caring for at home. We're very concerned about being overly exposed, and had to continue working, unlike the school sector, which in many states and territories had shut down to students and moved to a completely online environment. There was also the issue of educator mental health and wellbeing, and I'll spend a bit more time on that at the end, but we were certainly seeing a lot of stress and anxiety across the sector, and bearing in mind we'd come off one of the worst summers we'd ever had in terms of bushfires, and many educators had to deal with either fire in their area or smoke, and smoke impacting on the delivery of service, and then straight into coronavirus, and managing the risks to both themselves and to children and to their teams. So that we had a lot of very tired and anxious educators and teachers. And then lastly, the relationship with families, and trying to explain what was going on to families, provide advice about whether children should continue to attend, to ascertain whether families were in essential worker roles and needing care, or whether they were able to work from home and look after children, and then supporting online learning. We have seen some fantastic examples of innovation in the time that children have been at home with parents. I didn't have time to pull the data together for you, but most services have experienced a reduction in the number of children attending, and may have had, say, 50% of the children attending and 50% of children at home with parents, where parents were juggling the work from home requirements as well as supporting children's early learning and early development. And so parents were really needing a lot of support from early childhood services with managing that, and services had to very quickly pivot to providing that, both the online support as well as continuing to operate for children that were still attending. And a number of speakers have spoken to this. There was really no capacity or time to provide good professional development on how to support early development at home or early learning, how to support families to continue to provide children with rich learning experiences, and particularly the importance of play and play-based learning in that context. However, there were some very good examples. I've got a little video that's embedded in the presentation if people want to look at it later. The ABC Kids, which is our sort of national public broadcaster, developed a lot of content to support early learning, as well as playgroups, switched very quickly to playgroup at home and providing Facebook groups that families could join and share examples with each other, as well as providers setting up online learning resources for parents and families. I've got one example in the slide here of Good Start at Home, which is one of our large not-for-profit providers that very quickly established support for parents to continue with their children's early learning in the home environment. There's also been a strong interest during the pandemic in online learning, online professional development for educators and teachers. Again, I've embedded a link here to one of our short courses. ECA provides a number of short courses through our ECA Learning Hub, lots and lots of webinars, and I must say an increasing acceptance of webinars as a way of engaging professionally and networking with other people and gaining information. We've seen a number of online learning communities develop, and we've also seen a proliferation of online events and conferences, and much better practice in online conferencing, I must say. The use of new technologies around that to really make it interactive and get people to talk to each other and engage with the presenters and really embrace online learning. I would say, particularly in Australia, there has been a bit of a reluctance, lack of trust in the usefulness of online learning before this pandemic, and one thing COVID-19 perhaps leaves us with is a greater engagement and acknowledgement of the value of online. I think we're all very keen to get back together face-to-face and having in-person events and in-person conferences, and I do hope that we get to do that soon. But to acknowledge that we can now use a blend of both online and in-person is terrific. And I'm happy to answer questions because I'm conscious that my presentation has been very sort of broad brush and not as perhaps detailed or data-based as some of the other presenters. But I would say the learnings that we take with us from this period is to embrace technology and to engage in innovation. Also, the absolute importance of supporting educators and teachers and doing that as thoroughly as we can and as quickly as we can. We really have seen a growth in the skills and knowledge and a broader public awareness of the importance of the work. Early childhood educators have been acknowledged as essential workers on the front line of this pandemic, and there's a greater appreciation, I think, for the work that they do and how important it is both for children and for parents. And the other thing that I really hope we take with us out of this is a partnership between families and educators and teachers. And while we've always had that as a central part of our approach to quality in service delivery, I think there's a new closeness, a new respect, a new level of collaboration between educators and teachers with families as a result of this pandemic. Thank you.
Yes, there's definitely some questions there, and I'll have a session for questions a little bit later on, but thank you very much for sharing the situation in Australia and what Australia is doing, and especially those interventions around professional development. And I guess that is a silver lining of the pandemic, is that we have had the opportunity to strengthen online learning in all of this. So I'll now hand over to Li Ji Tan for our final presentation. So thank you very much, Li Ji.
Good day to everyone. First of all, I would like to thank ARNEC for the opportunity to join the webinar. This is indeed a very relevant and important topic for us in this time frame. My name is Li Ji. I'm the Assistant CEO at PAP Community Foundation. We are a charity, non-profit organization. And go to the next slide, please. Okay, we manage about 360 childcare kindergarten across Singapore, largely located in public housing. Our mantra is really to provide affordable, accessible, quality preschool education for the people living in the various housing estates across Singapore. Currently, we have about 40,000 children enrolled in our preschools, and they are taken care of by more than 7,000 qualified preschool teachers. We have a very diverse workforce. Some of our teachers are in their 20s and some of them are in their 60s. So and also we are racially diverse as well, taking care of people from various backgrounds and different races. We are a non-profit, as I mentioned earlier on. Our financial resources comprise mainly the fees that we collect, as well as the operating grants from the various government agencies. All right. The COVID situation has indeed, turned our world upside down. Since the early part of this year, we've been managing many changes in regulations, travel ban, quarantine, numerous developments and government pronouncements. There were questions about whether we should or shouldn't wear a mask, and travel restrictions are impacting our staff. Some of our staff are from Philippines, and some are from China, different parts of the world, and India as well. So we also had to work on developing appropriate safety measures for children and for the staff across PCF. And being a very large organization, we had to make sure that the measures that we recommended or are adopted at the various center. There was also a lot of anxiety on the part of parents and our staff, because COVID was such an unknown in the earlier days. And in addition, we also had to provide limited service, which is in Singapore, there is something close to a lockdown, but not quite. So most services were suspended from April the 7th to June the 1st. And during this period, all of us had to work from home, except those who were classified as essential services, primarily the healthcare workers, the people in security, and a few identified industries. Early childhood providers had to provide limited service only to the qualifying children. The rest of the children would have to stay home with their parents, who also had to work from home. So work from home took on quite a different meaning then. Next slide, please. Amidst the complications and the worries, pieces of incidents and news kept cropping up. For example, one of our PCF center, we had more than 10 educators, teachers, and center principal who came down with the COVID-19 infection. And that was pandemonium because parents were worried, were the children affected, were the other teachers affected? Regulators, healthcare workers were coming down to check our centers. We had to deploy professional cleaners for deep clean, and many things were happening at the same time. And the rest of the teachers and staff who were not infected were very much affected as well. In addition, in many locations, preschool teachers who were renting facilities either on their own or jointly with friends, they face landlords who were going to evict them because perhaps amongst the three of them sharing an apartment, one of them came down with COVID, or somebody who is a teacher from China, and the landlord felt that he didn't want to take the risk of having a PRC person rent, the apartment. So there were a lot of upheavals, even in terms of a basic thing like accommodation. And before the school reopened on the 2nd of June, the preschool, I mean, all preschool staff had to take the COVID-19 swab test. And some of the educators were very worried about what that means and the discomfort, and also the worry about having to go to a testing center and contracting the virus in case somebody else there is asymptomatic. So there were a lot of worries and concerns that needed to be addressed. Next. So we had to, from the very early days, come up with some strategies and some plans. The most important really is to have a single point of communication to both parents as well as the teachers regarding the national level preschool directives that were given by the Early Childhood Development Agency. We were very fortunate that prior to the outbreak of COVID-19, we had for the last 2 years been putting up this parent engagement portal, which is like a website where we engage parents. We could contact them via the portal. We could send them notices, circulars, even the portfolio of the children, how the children were developing the reports. We could communicate via this portal. It's a secure medium. So with this portal, it enabled us to communicate very quickly and effectively with parents. Of course, knowing that not all parents will log into the portal all the time, we backed it up with phone calls from the center. But I must say that this point of communication was critical in managing the situation. Now, in addition, for the staff who had accommodation issues, our HR stepped in. We worked with some agencies to make sure that we could help by means of, for example, negotiating with the landlord, even though it's a private matter. In some cases, we had to put up our staff at temporary locations and support them with the financial means to stay in those temporary locations. But luckily, this was few and far between. Now, in addition, this enforcing work from home and limited service arrangement was not easy to implement. A lot of our staff are quite used to face-to-face interaction with the children and with each other. So working from home was something new to them, and they felt that it wasn't convenient because, at school, all the resources are there. When you work from home, what do you do, and we also had some staff who didn't have, who had a laptop at home, but that was being shared with their son, with their daughters, and with their husband. And when everybody worked from home and there's no school, then everybody is going after the same resources. So we provided laptops, devices on loan from our HQ to our staff who needed them. And we had to enforce this work from home because it was a national directive. And we had to select some of our teachers to provide the limited services, limited childcare service to children of essential workers. In the meantime, we had a very short runway, but because we had a strong team at our HQ level, we could put up on very short notice the necessary e-training for continued professional development. For example, we were worried that in our zeal to conduct distance learning, some of our teachers may use materials that are intellectual properties of certain publishers who may not want it to be used on a wide scale basis. So we had some courses on very short notice, bite-sized online courses for our teachers on how to conduct synchronous or asynchronous learning via Zoom, via Microsoft, via the various platforms, as well as quick training on copyright laws, what they can use and what materials they can't use and how they can use it. So there were a lot of short bite-sized courses ongoing, and our teachers could attend all of this online. It helped them in a very short time frame to get up the curve. Next, please. Okay, we also know that our teachers and our students are very visual. And what we did was we put up posters, we designed and put up posters with very simple instructions related to health, hygiene. For example, on the left, you can see practice social responsibility. If you are unwell, see a doctor and stay at home. A lot of our teachers, their mentality is that, what if I'm not around? What will happen to the children? Who is going to look after them? What if there are not enough teachers at the center? So they want to come to work even though they are not well. And we had to tell them, in a time like this, you know, social responsibility takes precedence. There's also the temperature taking. We had to enforce temperature taking 3 times a day for the children as well as for the staff. Very often the staff forget about themselves. They take the temperature for the children, but they forget about themselves. So we had to find a way to enforce this. And the issue of safe distancing, it's the same thing. The teachers try to enforce safe distancing, keeping 1 meter apart for the children, but they forget themselves. So we had to, you know, remind the teachers, please look after yourself as well. And what we did was, if you see the F at the bottom, we wanted to foster a caring culture by getting the teachers to partner each other. So I will keep a lookout for you and you keep a lookout for me. If I'm not well, please tell me to go home, that kind of thing. Now, the second poster we had was a little bit different. It was on staying hydrated, making sure that everybody drinks enough water, washing their hands and washing it thoroughly, and, you know, not to touch their eyes, nose, and mouth, and to keep an active lifestyle, to be mentally healthy as well. So we had all these posters put up across all our centers. We want this thing about fighting COVID to be a positive movement rather than fear and anxiety. And you can see, you know, on the extreme right, we developed e-stickers. So if somebody did something right, we'll send them a sticker and say, awesome, or stay safe, or, you know, you did well. So we developed e-stickers to put a fun element for both the teachers as well as the children. Next slide. Now, one of the worries topmost in our teachers' mind was during the COVID period, whenever anybody has a cough, cold, or, you know, some respiratory tract infection, the doctors would typically give them 5 days medical leave. Our teachers have got 14 days medical leave allowance a year. If each time they see a doctor, they get 5, then 3 times they will have used up their medical leave allowance. They were very worried, you know, about using the medical leave, and they didn't want to go and see a doctor. But we told them that, you know, on top of the 14 days medical leave, they have another 40 over days of hospitalization leave. So if they run out of medical leave, they can use their hospitalization leave allowance to cover, you know, for the outpatient leave that they need to take. And this gave them some assurance that, you know, when they see a doctor, they don't have to worry about running out of medical leave. In addition, this COVID thing came upon us quite suddenly. So, you know, how do you conduct distance learning? How do you do online learning? So we had a team of curriculum specialists at HQ, and we designed a series of easy and engaging resources for our teachers and for our parents. So we had educational toolkit series 1, series 2, up to series 7. And these are like activities that the children can do at home with their parents. This educational toolkit covers the gross motor skill development, social emotional development, numeracy, literacy, and there are little notes at the bottom that tells the parent what the objective of the lesson is, and these are things that parents can engage with the children. We also had game cards where the children can play, and these game cards are designed to remind them of the various hygiene and care practices and behavior that they need to adopt, like keeping a distance, wearing a mask, etc. So we also developed an e-book. If you see the e-book there, When I Am Sick, so basically it's an interesting book that tells the story of this child who was sick and what he did. And this is an e-book which you can download into the portal, and parents can read it to the children. We have also printed big books that we place at all our centers where teachers can share with the children as well. So all in all, we want to tell the children what is this virus about so they understand. We also want them to know how to navigate. Yeah, so we had ABCs, meaning we control the access to the centers, and means children and adults who come in, who is allowed to come in, what must they do, take temperature, do health check, etc. And behavior, meaning we must remember to keep our distance, we must remember to wear our mask, we must remember to hydrate. And then classes will be, what can we do in the classes to make sure that it's safe for everybody? So basically we had the ABCs again in our posters, in our reminders throughout the center. So these are some of the simple things that we put in place to support our educators Next slide, please. Yeah, and back to school, the same thing. Back to school, we did it in a very orderly manner, where all schools were given some pre-opening guidelines, right? And we had meetings before the pre-opening to engage the teachers and make sure they understand what it means. And also we resourced the center. We provided the centers with all the things they needed, be it masks, sanitizers, signage, books, etc. So next slide. So you can see the children, on the left, you have a safe distancing ambassador, the children will be a safe distance hero, and she will make sure that the children keep their distance while queuing for the washroom or things like that. And then increasing the frequency of health check. We mark spaces on the floor for the children to do the activity so that they keep a safe distance. And we also color code the classroom, so it's easier for the children to know which group they should stay with and not mix around too much. Next slide. Yeah, so the key takeaway, this is the last slide, is that communication is very important. There will be situations at the center where the teachers may find challenges, and we need to work with them. We need to assure them that resources and help is on the way, and that ample resources will be given. And all-in safety is a responsibility of everybody, and it can be overcome. So I think that's a message we want to give to everyone. Thank you.
Thank you very much, Lee Ji, for your presentation on the strategies and plans that Singapore are introducing for the pandemic, and how you're supporting parents through the portal and phone calls, as well as staff with home and working from home and training support. If I can just ask all of the presenters to now turn on their videos. I'm going to take a few questions from the Q&A box, as well as some of those that we've received earlier from registrations. I might start with you, Dr. Chen. Many questions have come in about online classes and ECD. Obviously, learning online for early childhood is very difficult. So the questions are around, are online classes developmentally appropriate for children of that age group? And how long should they be, and what kind of activities can be done online for ECCE?
Right. Really, of course, face-to-face is always better than online, but the online has so far have been found quite successful, because the online not necessarily. In fact, one of the school actually used the online as though it is a classroom. The children come in, they were registered. There's a clink, there's registered, so it is like a normal classroom. And they have activities, group activities, and they even have lunchtime together. So I think I will answer the two questions together. So again, if you talk about time, it depends on what kind of activities they are doing. If it is just work, I don't think the children can they can concentrate for a long period of time. But if it's with activities, the exercise they're doing, the music, the dancing, and so forth, and all this social kind, where they have social activities, I think it could be at least for 2 hours. So if they do have, as well as social, as well as intellectual, they have also games, they have also drawing and art. So definitely these activities would help children to develop. And definitely to have these online activities are much better than not having any. And I think what is very important is that children get bored if they're nothing to do. And we actually recently we had a webinar on the well-being of children, and so they need to have this activity. And when they have this group activities like having lunch together, they see the friends, so they don't feel that lonely and so lost. And if they do not have stimulating activity, they are not mentally challenged. They get bored. And when with boredom, you have a lot of mischief, a lot of they will be up to all the kind of reckless activities. So yes, I do believe that it helps with even with social development.
Thank you very much. And I think there's some very interesting points. Obviously, face-to-face is better, but in these times, adapting to what we have and yeah, using the best of the technology available. The next question I'll put to both Samantha and Mackie. It's quite a big question, and lots of questions came through about it, and this is to do with assessment. Obviously, assessment cannot be done in the way that it has been. So the questions are around what are the new norms in test administration, and how can the ECE workforce be guided for assessment for children's remote learning, particularly when they haven't had access to social environments and motor skill development, and particularly around the disparity that has probably arisen during lockdown. So for children with disabilities, as well as poor families that may not have had access to IT capacity, how will we be assessing and catering to those students?
Look, I'm happy to go first. For us, one of the better sides of the policy that was made during the pandemic was to prioritise children who were considered vulnerable or at risk of educational disadvantage. And we actually had a number of providers reporting retention of children who they were most concerned about in attendance at services. So that's that, and actually those children potentially had more time with educators because there were smaller numbers of children attending and higher ratios of staff to children during that time. So there's some good news story in there in terms of vulnerable children having greater access to early childhood education during the pandemic than they perhaps otherwise would be. However, I don't want to suggest that that's the story for everyone. There would indeed be children who were at home who had poor access to internet connections and their teachers and activities that were provided for them by the early childhood services. I think what we're hoping now, as we go back to a new normal, we're seeing enrolments increasing again, we're seeing children coming back into services, is that services will be able to assess the children that need more support and provide them with as much intensive support as they can between now and their transition to school either next year or the year after. We don't do a lot of formal assessment as such. We do assessment for development and assessment for programming, but not testing in the same way that some other countries do in the early years.
Thank you, Samantha. Mackie, do you have anything to add about assessment?
Maybe just one point. I have to say that I don't really have much concrete example that I could actually share at this point. But then we have actually conducted a small study or survey again on learning assessment overall. Of course, the assessment nature of our survey is different from the one that we will actually typically see in early childhood. But I felt like there will be one kind of example that could be applied even in the early childhood setting, is that because of the situation, how to monitor your children's progress learning from home. And one way suggested that we found was to have parents giving guide how to monitor the children's progress during the home learning periods, and to be able to report and share what the parents have observed based on the guidelines with their teachers through the mobile app, so that teachers can actually come back and mention how to also support the children in certain learning areas. Of course, we may not be able to apply exactly the same with young children who are not necessarily talking about learning math and science and so on. But still, I think in terms of monitoring child progress is one common area that we are concerned with here. And although, of course, personal interaction is most important for the teachers to be able to monitor and progress the child development, I think the parents do play an even bigger role now in assessing the child's development progression here, and they can be guided by guidance and also through different media to be connected with their teachers as well. So maybe that could be an interesting example to be applied in early childhood as well. Thank you.
Definitely. Thank you, Mackie. And a very interesting point that parents are taking a much more active role now in early childhood, which just leads me to my last question for Ms. Tanley G. in Singapore, it seems that reopening has started to happen. So the question that has come through is, how can preschool educators partner with parents after the reopening of schools?
The partnership between the preschools and the parents?
Yes.
Yeah, I think before school reopen, we send a note to all parents via the portal, telling them what to expect. For example, their children, when they come to school, will all have to wear a mask for those who are aged above 2 years old, and what to pack in their school bag. And if their children are unwell, for example, if they have a cold or cough, then they should not be coming to school. So some of the do's and don'ts we explain to the parents beforehand. And when the parents bring the children to school, the parents need to understand that they are not allowed to enter the school premises. The health check is done outside to make sure that we check the children well before we accept them into school. So some of the measures may be a bit maybe applied more strictly than before, but given the current health situation, that is unavoidable. So the managing of parents' expectation is done before they come into school, and we share with them. Now, there are some parents who say, my child has asthma. So he doesn't then mean that he doesn't come to school all the time. So we have to work with exceptional cases, how to handle it, work with the doctors on whether these children can or cannot come to school, things like that. Yeah, so a lot of partnering with parents and getting their understanding. And parents are appreciated.
Thank you. Yes, and I think it's definitely making a new pathways for the way that parents and early childhood workers work together. Thank you to all of our panelists for their contributions at the webinar today. I've really appreciated hearing your presentations and what's happening in each of your countries. The pandemic has presented significant implications for the ECD workforce, with many challenges that may continue for the foreseeable future. And as we've heard today, the closing of preschool and ECD programs, the loss of income for workers, the disruption to the progress of the sector has made to date, and changes to delivery have been very challenging. However, it has been great to hear how the sector is working hard to respond to the problems faced by early childcare workers under the COVID-19 situation. So thank you for sharing your solutions and adaptations, such as online professional development, information sharing, inclusive distance learning, and using intersectoral approaches. And we've also been encouraged to advocate to support the health and wellbeing of workers, and encouraging governments to compensate and invest in training and resources for the early childhood workers to adapt to these changes. As we learn more through the coming data and generate more innovative solutions to the challenges we are facing, we can learn from each other and create new pathways and opportunities for the sector as we navigate through these times. So once again, thank you to our panellists for sharing your knowledge and expertise on the topic of the ECD workforce. I'll now hand back to Evelyn for some final announcements and remarks. Thank you, Evelyn.
Thank you, Jessica.
Thank you, bye for now.
And once again, thank you to all our presenters, our moderator, and of course, all our participants for a very informative session today. We've received a lot of good feedback from our participants, appreciating really the practicality of all the solutions and innovations presented, and also the results of the survey as shared by Maki. Before we finally close this webinar, just a couple of reminders from our end. We invite you to visit and share COVID-19 and ECD resources posted in our ARNEC Facebook page and in our website. Please like the ARNEC Facebook so you get regular updates in terms of the webinar and other resources. We also encourage you to respond to the webinar evaluation form, which we will be sending shortly. It will really help us in improving the management of future webinars and other learning platforms of ARNEC. Please download webinar presentations from ARNEC website. We do send FB alerts on the recording and presentation, so please follow us on Facebook. Lastly, for ECD workforce related resources, please visit the ECD Workforce Initiative, which is hosted by ISA, International Step-by-Step Association. You can see the link to ISA's website in your screen. They have a lot of ECD workforce resources, so please visit their website. Again, thank you for participating in today's webinar. Stay safe and keep well, everyone. Thank you.